In tonight's Healthy You, we are talking about the most common form of cancer for young men, testicular cancer. It affects about 10,000 every year. 13 on Your Side health reporter Elena Holland has the story.
It's not something men talk about very often.
For young men, it's a personal, sensitive issue. They're always, I think, some hesitancy to see their physician.
But men should be, well, checking downstairs often.
Testicular cancer is actually the most common cancer in men aged 15 to 45.
Dr. Peter Van Veldehuizen is an oncologist at University of Michigan Health West. He says men should be checking monthly, starting at age 15 for any pain or masses or something not feeling quite right.
Usually in the shower, because it's an easy place to do. The examination is easier.
Here's the good news. While testicular cancer is the most common cancer among young men, it's also highly treatable and often curable.
The treatment usually involves surgery to remove one of the testicles.
If detected early, there's much lower risk. Later detection could mean higher risk for chemotherapy side effects, fertility issues, or long-term toxicity. Not only is this cancer common in this age group, but it's also quite broad.
There's not a specific group that's spared or, at a lot higher risk.
Dr. Van Veldehuizen says for reasons unknown, cases have been increasing to some degree.
In the past, it was one of the cancers that was much less in African Americans, but we've seen a trend up in that population as well.
So men, use your shower time not just to test out your singing skills, but also to check for cancer.
There's always a hesitancy of, it's a personal, if we find something, but it's better to get it checked. It doesn't always mean that it's cancer related, and early detection can result in much more limited treatment and getting back to normal.
Elena, what happens if a man does find something during a self-exam?
Yeah, so a doctor will perform an exam and then it will be determined if there is a cancer risk. If so, there will likely be an ultrasound and a blood test. Surgery is the main treatment for this cancer, but if caught early, there could be other measures.
Thank you, Elena.